Do you know what the leading cause of death worldwide is? It's ischemic heart disease. Now you might be wondering, what exactly is ischemic heart disease? Well, in essence, it's a condition that affects the blood supply to the heart. When this happens, your heart doesn't get enough oxygen and nutrients, leading to heart muscle damage and even heart failure. But why is this disease so deadly? It's because the heart is a vital organ, like the engine of a car. If the engine stops working, the car stops moving. Similarly, if the heart stops working, the body stops functioning. Ischemic heart disease is like a silent assassin, often showing no symptoms until it's too late. That's why it's critically important to understand this disease, to catch it early, and to seek treatment as soon as possible. Understanding ischemic heart disease can help you recognize its symptoms early and seek treatment. So, what causes ischemic heart disease? Well, there are several factors that play a significant role. And these include high cholesterol, elevated blood pressure, diabetes, and smoking. Now, let's break these down a bit. High cholesterol can lead to the formation of a substance known as plaque in the arteries. This plaque sticks to the walls of the arteries, making them narrow and less flexible, which can restrict the blood flow to the heart. High blood pressure, on the other hand, can damage the arteries, making them more susceptible to the accumulation of plaque. Diabetes, particularly uncontrolled, can increase the risk of heart disease, as high sugar levels can damage arteries over time. And smoking? It's a major culprit too. Smoking can damage the lining of the arteries, leading to the formation and accumulation of plaque. These risk factors, if not managed, can lead to the development of ischemic heart disease. Now that you know the causes, how can you recognize the symptoms of ischemic heart disease? Ischemic heart disease, also known as coronary artery disease, often presents itself in a variety of ways. The most common symptom is chest pain, also known as angina. This discomfort can feel like pressure, squeezing, fullness, or pain in the center of your chest. It might even feel like heartburn or indigestion. Another significant symptom is shortness of breath. You may find yourself gasping for air after minimal physical exertion, or even while resting. This can be a sign that your heart isn't pumping blood effectively. Fatigue is another common symptom. You might feel unusually tired or weak, particularly after physical activity. This can be due to your heart working harder to pump blood through narrowed arteries. Irregular heartbeat or arrhythmia is another symptom to watch out for. You might feel like your heart is fluttering, pounding, or beating irregularly. This can be a sign that your heart isn't getting enough oxygen. However, it's crucial to understand that these symptoms may not always be present. Sometimes, ischemic heart disease can be silent, causing damage without noticeable symptoms. This is why regular checkups with your healthcare provider are so important. You know your body better than anyone else. If you feel something isn't right, trust your instincts and seek medical attention. Recognizing these symptoms early can lead to prompt treatment and better outcomes. So how is ischemic heart disease treated, and can it be prevented? Let's delve into that. Treatment for ischemic heart disease is often multifaceted, involving a combination of lifestyle changes, medication, and in some cases, surgery. Lifestyle changes are a cornerstone of treatment. These may include adopting a heart-healthy diet, regular exercise, and maintaining a healthy weight. For those who smoke, quitting is absolutely essential. Medication can also play a key role in managing the disease. Doctors may prescribe drugs to lower cholesterol, control high blood pressure, or thin the blood to prevent clots. In more serious cases, procedures such as angioplasty or bypass surgery may be necessary to restore blood flow to the heart. But what about prevention? Can we stop ischemic heart disease before it starts? The answer is a resounding yes. Many of the prevention strategies mirror the treatment approaches. Maintaining a healthy lifestyle is paramount. Regular exercise, a balanced diet, and weight management can all contribute to heart health. Additionally, avoiding tobacco and limiting alcohol intake can significantly lower the risk of developing this disease. And finally, regular checkups are vital. They allow for early detection and management of risk factors like high blood pressure and cholesterol levels. While ischemic heart disease is a leading cause of death, understanding the disease, its causes, symptoms, and treatments can help prevent it and improve outcomes. Let's quickly recap what we've learned today. We dove into ischemic heart disease, a deadly condition where the heart's muscle doesn't get enough oxygen due to narrowed heart arteries. We explored its causes, mainly unhealthy lifestyle choices and certain medical conditions. We identified its symptoms like chest pain and shortness of breath. Lastly, we looked at its various treatment options and how lifestyle modifications can help prevent it. Remember, knowledge is the first step towards prevention. Stay informed, stay healthy.